Third question. A 24-year-old woman gives birth to a newborn at term. The Apgar scores are 9 and 10 at 1 and 5 minutes respectively. 30 minutes after birth, the mother's blood pressure drops to 80/60 millimeter of mercury and her pulse is 124 per minute. On physical examination, her distal extremities are clammy and cold and the uterus is boggy. Aggressive fluid resuscitation is initiated. After administration of 4 units of IV fluids and 4 units of whole blood, her vitals stabilize. The next morning, she says she's unable to lactate when she tries to breastfeed her newborn. Which of the following is the most likely cause of the failure of lactation in this patient? Okay, moving on to this one. Once again, most of you got this right. Okay, so yes, the answer is pituitary infarction, otherwise known as Sheehan syndrome. Okay, you can kind of see that with the hemodynamic instability immediately after birth. But even more than that, the most important thing is the inability of the patient to lactate, the next morning. Okay, so pituitary infarction or Sheehan syndrome, results in hypopituitarism. Now, this you kind of need to understand a little bit of what exactly happens during pregnancy to just have a better understanding of the syndrome. So essentially during pregnancy, the hormones are elevated, but specifically estrogen has an effect on the pituitary that causes it to expand. Okay, now following delivery, when the hormonal levels pretty much drop down to baseline or drop down drastically, okay, the blood supply to the pituitary gland automatically gets cut off. So that results in infarction. Okay, now this infarction results in a decreased function of the gland, which is what I mentioned earlier, hypopituitarism. Okay, so because of that, patient will present with not only inability to lactate in this particular scenario. Yes, sometimes they'll also mention hypothyroidism. Okay, they might present with primary adrenal insufficiency or secondary adrenal insufficiency. They can just present with anything that causes decrease in any of the 6 pituitary hormones. Just remember that they most likely this is how they will present the thing, but there will be times when they do mention sudden hypothyroidism or fatigue and all the other signs, cold intolerance and basically all the signs you see in hypothyroidism immediately or within a day following delivery. Again, think of only Sheehan syndrome as nothing else. Okay, so pituitary tumor, unlikely, in this particular case, given the symptoms, because most likely they will mention a bitemporal hemianopia, and this is just because of the proximity of the pituitary gland to the optic chiasma, so it will press on it and cause the visual field defect. But also another important thing, especially in women, since the most common form of pituitary adenoma is a prolactinoma, they'll usually present with galactorrhea amenorrhea. Okay, so in this case, patient is unable to lactate because of the decreased prolactin. So whereas in the case of prolactinoma, you're going to have very high prolactin levels. It kind of contradicts. Rule out option A. Postpartum blues. This is something that women, some women may present within 2 to 3 days following delivery. They may present with extreme fatigue or they just become very emotionally unstable. Okay, they be tearful all the time, and there's no real treatment for this. It's just supportive therapy. There's nothing else. And since once again she does not present with any of these symptoms, you can just rule it out. Moreover, postpartum blues can resolve on its own within 10 days to maybe 2 weeks, so you don't really have to intervene. Okay, remains of placenta in uterus. Now this is a cause of postpartum sepsis or puerperal sepsis. Okay, though this patient's immediate hemodynamic instability following delivery can suggest sepsis due to this. Okay, this would have been fine had they not given the last part of the question, which is unable to lactate. So if that wasn't given, you could have considered puerperal sepsis as a cause. But since it's mentioned very clearly that it is hypopituitarism, you can just rule out puerperal sepsis. Okay, option D is the right answer. I already mentioned why. Option E, pituitary hemorrhage, is known as pituitary apoplexy. Once again, tie it in with the first option because this commonly occurs only in those with a pre-existing pituitary tumor or pituitary adenoma. Okay, and this essentially results in a sudden hemorrhage into the tumor, and signs and symptoms of that are nothing like this. They'll present with sudden headache. They'll present with a bitemporal hemianopia. They can present with diplopia due to oculomotor nerve involvement. Okay, and they can also present with hypopituitarism. Okay, but don't get confused because the other 3 signs and symptoms that I mentioned are more specific for this. Okay, the headache is very, very specific for this. So if that's not there, don't just go for the one thing out of the 4 different clinical features and assume it's pituitary hemorrhage. It's not. Most of it points only to Sheehan syndrome.
Thanks for watching. Please give a thumbs up and subscribe for more.